So on the policy side, we focus here specifically within the Alliance on how do we actually address those issues that are really barriers to adoption in this technology. And that happens at three different levels. So there's one at the at the federal level, which is how do we make sure that the legislative branches of government certainly have the right pieces of puzzle in play. We focused on that about 3 years ago when the ACA, the Accountable Care Act, was actually being passed. And in addition to that, the high-tech, to ensure that the funding was going to be available and that we were able to actually include these types of technologies as a new model for healthcare moving forward. It actually did fund some demonstration projects, but more importantly, it actually led to the legislation around Meaningful Use 3 out of the High-Tech Act. And Meaningful Use 3 really is focused on that patient self-reported data and being able to allow physicians to be engaged in that area. The second factorial that we have to take a look at is the regulatory components of that, and that is the FDA, making sure that the FDA processes are in place and appropriate to be able to use these technologies. Because this is completely a new area for the FDA to understand and how to implement these types of capabilities. We've hosted a couple of activities with them, and over the last 3 years, it's resulted in some outputs such as the mobile medical guidance that came out in 2011. And we are expecting to hear more from the FDA this year around how they look at placing that activity in play, how to really get these devices in play. This also plays into the FCC as well, because we're now using mobile technology, so therefore it's more wireless-based types of capabilities. We saw some advent of some of the new policies from the M-band architecture that they just recently released, which is a specific spectrum. But more importantly, we're just recently seeing that the FCC is going to be active again in this area by hiring a doctor to focus on this type of activity as well. So I think that's the second component. The third thing that we have to focus on here too is state-by-state legislative activity. And in certain areas of the U.S., it actually is somewhat still prohibited to really use this technology effectively across a wide spectrum. So where I live in Texas, we're focusing on some of the legislative activity to ensure that we can use this technology in place and have that available, because there are some certain state restrictions that limit what we can do with this technology. So we focus specifically on those three big, broad topics on policy. But when you take a look at those that have actually been approved by the FDA as be usable, that's less than 100. So what we have is a very limited data set of applications that have actually gone through the rigors, as you mentioned, of the clinical scientific studies to actually prove some level of efficacy in the back end. And so there is this dichotomy, because the medical community is saying, I need something that's proven, but the consumer community is used to, I'm going to go out and download whatever I want because I think it looks cool today and I'm going to use it. And we have to figure out sort of that branching between those two activities and what's going to really allow us to move between what we consider to be a free-for-all, which is not what we completely want, because we are dealing with medical conditions, we are dealing with medical serious issues here, and that have some serious outcomes, and we don't want the essence going back to the snake oil days of trying to sell an application. Yeah. As being able to be treatable in this case. So we want to make sure that we get the right types of policies in place, and that sort of led to that there's a very limited set for the physicians to use today, and there's a whole wild west of applications that consumers are looking at today. The question is, do we really see a difference between those apps that are simply presenting, they're basically a user interface that just represents the data from the device itself, versus those that actually take the data and do something with it. So they actually calculate a measure, and in essence what the term here is that it has some clinical decision support capability in it. And the answer is yes. Those that, the FDA as part of their mobile medical guidance is already starting to look at this aspect. If you're simply only passing data, really all it is you're repeating the exact same data that's in the device, that's low risk, and they don't really have you basically can pass an FDA certification in that case. If you're doing something with that